You're listening to The Mountain Spirit, a podcast of Christian Appalachian Project. I'm a firm believer that we're all connected by our shared humanity, and that finding that intersection sometimes just means having a conversation. Today, we get to hear from Dr. Angela Carman, an associate professor at the University of Kentucky College of Public Health. She's also an endowed chair in health policy with the Foundation for a Healthy Kentucky. I must confess that I didn't think much about public health until the pandemic, but I was glad to know that there are people who thought about it and how to have better health outcomes, not just in a crisis, but in our everyday lives. I'm excited today because we get to talk to a guest about public health policy in rural communities like Appalachia, but also public health policy in general. So buckle up. I'm hoping we're going to all learn a lot today. Hello, Dr. Carman, and welcome to the show.
Thank you. It's great to be here.
Well, we're so excited to learn more about public policy in general and rural America. And so why don't we just start out by saying, can you define what the term public health covers and what drew you to this field?
Oh, sure. A lot of people will want to know exactly what does public health mean. So whenever I'm talking to my students, I usually take them to the World Health Organization's definition, and that is that public health is both an art and a science of preventing disease, prolonging life. We promote health, and it's done through organized efforts of society, meaning we are working with people to improve the health of communities, groups, rather than individuals like our colleagues in medicine might be concerned about.
So what do you think is misunderstood when we think about public health policy?
I think when you say the word policy, a lot of people instantly think of rules or restrictions. And public health policy is actually taking what we know to be good, to be safe, to be healthy for people and making it an option for everyone. Things like speed limits and child safety seats and vaccines for school attendance, those are just a few examples of what we mean by that.
So when we talk about policies that may seem far away from us, like something that happens in our state capital or the nation's capital, as citizens, can you give us some examples about how public health policies impact us no matter where we live in the country?
Sure. I think it might be helpful to distinguish between a law and a policy.
Okay.
A law is an established procedure, a standard, a system of rules that society must follow. They're things like constitutional law, statutes, regulations, things like that. A policy is a decision or a set of decisions that are meant to address a long-term purpose or a problem. The policy, it's not itself a law, but a policy-making process often identifies laws that are needed to accomplish where we're trying to go. So things like when you consider a long-term problem, we might think about the need to reduce the impact of exposure to, say, cigarette smoke. A local policy for that might be an organization, any kind of business that decided to prohibit smoking in their building. So it applies only to people who work there or visit that institution. A law, however, it goes through the regulatory bodies of a city, a state, or even at the federal level, and would cover all the people within that jurisdiction and also have penalties for noncompliance. So people everywhere deal with policies all the time, and then laws as well, but they're slightly different.
That makes sense. So you're already making us smarter today. So in Kentucky, I learned as I was preparing for this podcast episode, there's a specialty in urban health policy that is centered at the University of Louisville and a specialty in rural health at the University of Kentucky. So urban and rural, how does public health show up differently, whether you live in an urban area or rural area, or is there a difference? Or how does it show up the same?
That's a great question. Whenever we identify a problem in a community that impacts health, it's really important to investigate how this problem came to be. And so with health issues, we often use what we call systems thinking to peel back the layers of the problem's development. And what we've learned over the years is that there are many drivers of health issues that may not even sound like health related at all, but they are. We call them social drivers of health. It's things like educational levels, economic stability, your built environment that could include housing, food availability, sidewalks, access to healthcare, all those kinds of things. So in urban and rural areas, those things may look a little bit different, and they may have different context within which they are operating. So you need to know those things in order to try to improve the health. But also, there's a difference in resources often that are needed to address the specific issues and the availability of those resources to improve education, to improve access to health, things like that. And not only resources, but political will to address those issues. So those can show up differently in urban and rural areas. Some research tells us that urban areas often have more services available. Now, whether or not people can access those services, that's a different question, but they often have more services than rural areas may have. But it's just so important anytime you're going to work in a community to try to make things better, to understand the context and to work with those people who live there.
So it's not just coming in and saying, I know, and I'm going to tell
No.
you, it's figuring out what that local community needs. That's
Right.
a very good observation.
And what they're passionate about. I can walk in there and say, okay, by the statistics, you all have a very high level of, say, lung cancer. If that's not on the forefront of people's minds, suppose they're much more concerned about the rise in crime levels or overdose deaths or whatever the concern might be. We've got to start where the people are, where their concern is, where their passion is, to be able to do something about it.
That makes perfect sense. That is a great lead into our next question, which is, can you share with us the focus of your work and what drew you to have a heart for rural public health?
The way I phrase it is, it's the practice of public health. It's things like community engagement. I even work with a lot of local public health departments on accreditation readiness and the steps for that, quality improvement. I've done some work in evidence-based practice implementation. It's the practice of public health. How do we do it exactly? And then what drew me to it, I'm a native Kentuckian. I grew up in rural Kentucky. These are my people. I want to do whatever I can to help Kentucky rural communities be as healthy as possible. And I spent the first 18 years of my career in healthcare administration. So I was working inside the hospital environment, and I saw there that people were repeatedly hospitalized for things that were preventable. So when I decided to change direction and come out of health care and go into public health, I wanted to help with that. How do we keep people from being sick in the first place?
Yeah. Yeah, that is such a great way of looking at, if you continue to see a thing, like how can you do the prevention or at least try to address it on the front end. And we talk a lot about intergenerational issues, that if you can help the grandma or the parent, that helps set the child up for better options and choices because they've learned from maybe changed behavior
Sure.
from that as well. So what challenges do you think exist, or what steps can be taken to overcome maybe some of the challenges in rural communities? We talked about resources, maybe access to services. What can we do, like, to try to, was that a part of the work that you do?
The work that I do starts at the level of engaging that community, because what we've learned, if there's an issue in a community, there's an answer in that community. You just have to bring the people together. We have to talk about it. We have to share our expertise. We have to be willing to try to dig into those social drivers of health and figure out, is it our economic stability? Is it the fact that we have a housing problem here that is leading to additional health problems? Those kinds of things. And when you get a group of educated, passionate community members together, you can see wonderful solutions rise out of that. So that's probably what keeps me doing this kind of work, is I've seen that happen, and people can make a big difference in their own communities.
Stay tuned. We'll be right back.
You can make this summer into a season of service and have a lifetime of impact on youth in Appalachia. Join us in the great outdoors by becoming a camp counselor at one of our 2 beautiful camps in eastern Kentucky. Room and board, stipend, travel reimbursement, and educational award are available. Apply today at christianapp.org/volunteer. That is christianapp.org/volunteer.
Where do you start if you've never thought about public policy, but maybe you've seen in your family that, you have a certain kind of cancer, a lot of the kids have asthma, or where do you start to get involved at your local level to address public health issues?
Oh, that's such a good question. People, when I pull groups together, they often say our community has a lot of different issues. So where do we start? And my answer is usually just start. And just start means let's dive into the issues. Let's figure out if we can possibly assess what causes the issues. Say a lot of asthma, we might find out that there's air quality issues. Maybe people are working in a certain location that has contaminants in the air, something like that. If we can dive in and find the where it all starts, and then help people see steps. There's evidence base out there where other communities have addressed very similar things. So I love to provide students and help from myself as well to dive into things like that and help a community find out what have other people done that works. And sometimes it's an intervention like smoking cessation or something like that. Other times it's more on the policy level, that either in an organization, a workplace, or for the whole community. It's very specific to the issue. And again, it goes back to that community passion. If you find that a particular community, I've worked with several communities that have such a heart and such a passion for children. And so that they tend to start there and look at early childhood intervention type programs that we could do and different things like that. So you just have to go to the community and know that they have the answer. We just have to help pull it out.
There you go. What are some of the impactful or innovative public health research that you've seen come out of the University of Kentucky that may be transformative for Appalachia?
Oh, there's so many. We're so fortunate at UK to have so many high quality researchers who are so dedicated to improving the lives of Kentuckians. In the College of Public Health, where I am, we have researchers working with a variety of issues. One relatively new study does focus on these social drivers of health that I mentioned before, and how the systems that exist within communities, if brought together, can figure out not only how to identify what the issues are, what social drivers need work in a particular community, but also how they can come together to do it. So we have work being done in that arena as well. We need to integrate both health care and social services together to solve the needs that are out there. That can be very transformative all by itself. We also have researchers, many researchers who are working on the issue of substance use and how we can better not only prevent that, but treat it and save lives for people who are dealing with the issues of substance use disorder. So many things that stand to be transformative for our Appalachian area.
So looks like we have a lot to look forward to of things that can help in the local community and how local people. So I'm hoping folks who are listening can think of how can I get involved if they're really passionate about that issue, and to know that there are solutions. And I love how you talked about other communities. We're not a unicorn. Other communities have faced some of these same challenges, and you don't have to start from scratch.
But our communities are special, and they're unique, and they have resources that sometimes they don't even think about. Expertise and knowledge of how things actually work there, and think that you need that to be able to move forward. So I'm a big believer in, as researchers or as people from the university, we're there just to be one more piece of the puzzle. We're not there to tell you what to do, but we certainly can help with what other people have done and what the literature tells us has a chance of making a difference here. And so we can work together on that.
Love it. Love it. Some public health issues, and we've touched on this a little bit, seem systemic, and some seem generational, and some seem overwhelming. In your work and with your students, how do you create expectations that lead to outcomes that show that real change is possible? It's like more like, how do you inspire them when it may seem like, this issue has been in this community for generations? Where do you start? How do you encourage, whether it's the local community or your students?
That's a great question. Because public health issues typically are very multifaceted. They take a while to see a change often. And so people can get a little discouraged. So, what we do with teaching, especially our students, is you've got to take a big issue, lung cancer or something like that, and break it down into pieces. We've got to set measurable goals and objectives. And it may not be something that's 4 or 5 years out, like seeing the rate of lung cancer drop, possibly, but it can be smaller things. And we call these SMART goals. So we try to set very specific, measurable, achievable, results oriented type goals and set timeframes around those. And those timeframes have us not expect to have solved the problem by then always, but to stop and see, where are we? Have things changed? Do we need to adjust our approach a little bit and keep moving? And you celebrate each one of those small wins.
You were recommended by Abigail here at our office, and former student, and she was just blown away. So very much inspired, and she was like, "You got to have her on the podcast to talk about public health."
I've been incredibly fortunate to have some of the most amazing students, passionate and excited about making a difference. A lot of them will start out thinking, maybe I want to be a nurse, maybe I want to be a doctor. And then we introduce them into public health. And it's not that we want to change their direction necessarily, but we want to show them that there are other ways to impact health. So if a clinical area is not really what you end up wanting to do with your life, the public health is another way to impact health, and doing it at community levels. So it's a lot of fun to watch the spark happen in a student about that.
And so, is there a story then that has stayed with you about why public health policy is important to prioritize?
One of the policies that I like to talk about, especially with my students, is it came around in 2015. And at that time, Kentucky statutes were passed that allowed our local health departments to be involved in syringe service programs. So before that, our local public health departments had not really been overtly involved in the substance use issues that we were dealing with. So many of the local health departments began to work in this space. They provided education on substance use as a disease and provided clean needles to prevent the spread of communicable disease, along with a variety of other services, everything from facilitating individuals getting into treatment to just meeting basic needs like clothing and food. And watching this evolve, the public health work that's happening here has saved lives. It's improved the quality of life. It's made a difference in an area that has impacted just so many families in Kentucky. So that policy, opening up that avenue for local health departments to serve, that's been so impactful. So I always think of that one.
Yeah. And so just hearing you talk about that and thinking about how the culture has changed, and sort of like, we're not where we were in the 70s or even in the 90s or early 2000s when it comes to substances. So can you talk a little bit about how changing culture maybe impacts what policies get adopted, or maybe how the longevity of you all's research, that you see the culture or public opinion change, and then that allows you to do a thing in public policy that maybe, you weren't able to do?
Oh, sure. That policy that I mentioned, allowing local health departments to work in syringe service programs, there was a time when that would never have happened. There was a time when people looked at substance use as some sort of moral failing, and that's not what it is. Now, there may be people who still feel that way, but we have done an enormous amount of research. We know it's a disease. We know substances impact the working of the brain, and we need to work with individuals who are suffering from that as a disease. And so that knowledge helped us know that there are ways that we can intervene. There's ways that we can keep the sharing of needles from spreading communicable disease, prevent people from getting stuck with dirty needles, things like that these programs address. So there was a time when I don't think that could have happened, but we as public health folks are very committed to educating when we learn something through research that could make a difference. And I think this is one of those areas where it did.
Stay tuned. We'll be right back.
February is a wonderful time to show some love to our neighbors in need in Appalachia. Your generosity has a direct and positive impact in the lives of people in need in Appalachia every day. It is the unwavering support of faithful friends like you that make this work possible. Many of our supporters are beginning to plan and envision what kind of legacy they want to leave to support the causes that are near and dear to their hearts. CAP is happy to provide a safe and easy experience for people to create a will and support CAP through non-cash gifts. Through our partnership with Free Will, CAP offers our donors the ability to create a will online and alter it at no charge. Our partnership with Free Will also includes their Smart Giving Suite, which allows donors to give through their IRA, donor advised funds, and stock online, in addition to creating a will for free. In recent years, Appalachia has faced unrelenting challenges, including the pandemic, inflation, and back-to-back natural disasters. You can make a life-changing impact and leave a legacy of hope in Appalachia. To learn more about non-cash giving opportunities, please visit christianapp.org/more ways to give.
Lots of people who've never been to a rural part of the country have their own ideas about what that's like, whether it's public health or economics or anything else. What is one stereotype? You said you're a Kentucky girl.
Oh, yeah.
What is one stereotype that you love to correct about rural America?
Oh, that's a good one. There are several, but I think the one that bothers me the worst is anytime on TV or in movies, if they want to present a person as, we'll call it, less than intelligent, they'll often give that person an accent that they think is similar to how people talk in rural areas. Similar to how I speak, actually. And in reality, people in rural areas are very intelligent. And their understanding and insights into rural community issues, it's critical. We can't make the improvements without them. And I can think of so many examples, even from in my own life, even from people that were not formally educated, but may still have such expertise and such knowledge. My own grandfather didn't get to finish elementary school, and yet he was one of the most intelligent people I ever talked to. And with his understanding of the land and what it took to make a farm go and things like that. So I truly do hate it when I see people from rural areas being portrayed as less than intelligent. That's just not accurate.
And do you, as you have students, do you find that your students from rural areas have to overcome sort of those stereotypes when they come to a college setting where maybe they are expected to not be at like science or math or
people start talking and they have an accent like mine, and sometimes people immediately think, oh well, they're either less intelligent than others, or they're not going to want to do the STEM type work, the science and technology and all that. And that's not true. That's not true at all. I have a wonderful student in my class right now, and on the first day of class, I often ask them, help me, give me something about you that will help me remember you, remember your name and that sort of thing. And he instantly told me that, he said, you've heard of one stoplight towns, right? And of course. And he said, well, I come from a town with no stoplight. And I said, got it. I know exactly what you're talking about. And he's capable of doing absolutely anything that anybody else can. But sometimes coming to Lexington from a small area and going to UK, which is a big place, is a little intimidating. And we need to provide additional support for those students and help them just navigate what we've got. And so we have several programs that we call first generation programs, that if you're the first person out of your family to come to college, we've got people that will help you. And we've got people that will, like, I've got a sign on my office door that says, ask me about my first generation experience. So they know who we are. We've been there too, and we can help with those questions that they might have.
So can you tell us a little bit about your first generation experience? What was that like for you? Where did you grow up, and how did you end up choosing where you went to college?
Oh, that's a pretty straightforward answer. I grew up in southern Madison County in Berea. We are very fortunate to have Berea College there. Berea College is devoted to students that have high academic goals and that they really want to go on to college, but also to those students with low financial means. And that's where I fit in. And I remember I have two older sisters, so they both navigated the how to get into college and went to Berea ahead of me. And I remember hearing a rumor when I was a senior in high school that maybe not as many people from Madison County were going to be accepted into Berea College. And I remember being horrified because my father said, honey, if you can't get into Berea, I'm not sure what we're going to do. And so we couldn't have afforded to send me someplace else. But I was very fortunate that that was just a rumor. And I was admitted, and I had a wonderful experience there. And one of the things that Berea does is instills in you that doesn't matter where you come from, you can do anything you set your mind to. And one of the things they encourage there that has really impacted my life is go back where you came from and make a difference. Well, Kentucky's where I'm from, so that's where I still am working. And that means a lot to me to be able to do that.
I love it. I love it. So what are your hopes for rural communities when it comes to public health in the years to come?
I think one of the big things is that citizens in rural communities will engage in processes that attempt to identify and improve health issues, that these citizens will be heard, and they'll stay open to policy or other interventions that have been shown to make a positive difference in health. We can do this. We just need the people who live and work in these rural areas to help and be there with us.
So what are you most looking forward to in your research that's coming up?
I'm in the process of building, I guess the best thing to call it is a learning lab for students that are particularly interested in rural areas. We're going to build some classes that we'll launch next fall where I'm going to take a group of students to a rural community and we're going to do some hands-on kinds of things. There's no better classroom than to take them out and let them see what public health looks like. And what I'm most excited about is for them to meet and work with those public health practitioners that do this work on a day-to-day basis. So I'm very excited about that. And I feel like if we can spark the passion in those students, we've just added to the numbers of people who are out there working to make things better.
I love it. Anything that we do that invests in our young people and help them follow their passion and dreams, love it, love it, love it. Dr. Carman, we have just flown through this interview. We're already to our last question that we ask every guest on the podcast. The mission statement of Christian Appalachian Project is building hope, transforming lives, and sharing Christ's love through service in Appalachia. Hope, transformation, love, and service. When you think of Appalachia, which one of these resonates with you the most?
Oh, that's a hard question. They're all such beautiful expressions of the kind of work that we do. I guess if I had to pick one, I'd probably say the concept of love resonates with me when I think of Appalachia. Not only do I absolutely love the natural beauty of the Appalachian area, but the people that are there. I always tell them, these are my people. This is where I feel the most comfortable. And how much they love their homes and they rally around their neighbors in the times of need. I mean, these are special, special people. So I think it would be love.
Awesome. Our show has been so enriched by having you on today.
Thank you.
I know I've learned a lot. I hope our listeners have learned a lot. And I thank you so much for being on and helping us all gain a better understanding of public health, not just in rural America, but in general, and why we should be concerned about it. Dr. Carman, thank you so much for being on the show today.
You're quite welcome. Thank you.
Our guest today has been Dr. Angela Carman, an associate professor at the University of Kentucky College of Public Health. She is also the endowed chair in health policy with the Foundation for a Healthy Kentucky. We hope you've enjoyed the show today and will check out next week's episode. Tell your friends to check us out too. You can follow the work of Christian Appalachian Project on all social media channels. But you can also find the podcast at wearecap.org/podcast or wherever you get your favorite podcasts. If you like the show, please take a moment to leave us a review. We surely appreciate it. As we said, we hope you've enjoyed the show today, that you've learned a lot about public health, and be sure to subscribe so that you never miss a new episode. We'll see you next week.